So when walking into the room, I'd start by doing a general survey and safety check, just making sure there's no hazards, anything that's going to trip on, making sure the patient's not in any distress, that the equipment around him is functioning properly. So I'm going to start, this is my documentation sheet here, with performing hand hygiene and introducing myself to my patient with my credentials. So hi, my name is Sarah Kennedy. I'm a second-year student nurse in the University of Manitoba. I'm just here to do a head-to-toe assessment on you, if that's okay. Okay, great. So I'm just going to ask them their names. Are you able to verbally tell me your name and your birth date? And then you just want to check to make sure those identifiers match the armband there, which they do, so it's great. I'm going to start by first taking his vital signs, so his oxygen, his pulse, his blood pressure, his respiratory rate, as well as his temperature. And then I'm moving on to our neurological part of the assessment. So we've oriented to person. We'll just do orientation to time and place as well. Are you able to tell me what day it is, the month, the year, and are you able to tell me where you are and why you're here perhaps? So you'd write on your documentation state alert and orientation ×3. So moving on, we can ask if they've experienced any pain, get them to describe their pain and where, document anything, get them to ask if they've had any headaches, dizziness, weakness. You can do a confusion assessment method as well if you see any confusion. You can do a particular response. We won't be doing that today, but take note of that. And you'll be checking for the NURS response on their hands here, just asking them, can you squeeze both my fingers here? So just checking the strength of that also for musculoskeletal, and can you give me a thumbs up and a peace sign. Great. And then we're moving to the end of the bed here, and again, just always noting abnormal findings as you go along with the documentation there. So I'm just going to be exposing your legs here, just maintaining patient respect and dignity. There you go. So with the neuro responses at the feet here, just are you able to wiggle your feet for me and maybe move your legs a little, okay? And can you apply some pressure to my foot like a gas pedal and then up, like down and then up, okay? So those seems good. Just going to look at the cardiovascular part. So just checking the capillary refill, just a bit of pressure here, making sure it's healthy, it's less than 3 seconds, and then noting if it was more than 3 seconds or less than 3 seconds. And then check the pedal pulses there. So just checking that they are strong and equal. So that would be +2, like that. And then moving up the legs here, we can look for any color, warmth, circulation movement, so they seem warm, the color is good, the hair is good, and then just noting for any edema, so any swelling or differences in sizes there, you want to check for, and then with any exposed area, we're going to look at the integumentary system, just making sure there's no wounds or at the cardiovascular portion, no signs of bleeding throughout the body, any risk for pressure or sores or ulcers. So we see that we have some necrosis on the toes there, so we'll be taking documentation note of that, as well as it looks like there's a pressure ulcer on the right heel there, so also noting that. Going to cover that back up, and then performing hand hygiene, those at the feet, and then with the cardiovascular portion of the hands here, I'm just going to be doing a cap refill here, just a bit of pressure. You want to make sure it's less than 3 seconds. You can do that to the other side as well, and then just bilaterally checking the pulse so that it's equal and regular, equality or strength of that, sorry, so you can write +2 on your worksheet there. Just going to put that here.
Okay.
And then again, you're looking at the color, any warmth, tenderness, or edema as well. You're looking for some do some pitting there, and then the hair distribution is good. The integumentary system looks good on both arms there, so that's great. So there's no IV access port, so we're going to take note of that. There's no signs of bleeding. So with the cardiovascular part, we'll also listen to the apical heart rate. We just want to make sure it's regular and strong. And we could first ask if they've been experiencing any chest pain. He hasn't, so that's great. So I'm just going to listen in on your heart rate there. Just making sure it's regular and strong. So that's good. And then with the respiratory system here, we're just going to make sure that we're just going to see if the patient has any work of breathing or dyspnea. So we're just going to look for any accessory muscle movement. They'll tell us if they're, ask them if they've experienced any shortness of breath, or coughing or chest pain or anything like that, or chest pain for the heart section there. And you're going to listen on those breath sounds for air entry on all lungs, depth. We did the rate and rhythm when we did our vital signs, as well as listen for any adventitia. So I'm just going to get you to take some breaths there, Oscar. And then making sure we hit all the lobes as well as the right middle lobe. So those breath sounds seem good. And just with the posterior again, we'll be listening in. I'm just going to do it on the front here, just starting a bit higher. And again, just making sure you hit all the lungs. Okay. And then the patient doesn't look like they're on, or they aren't on any oxygen therapy either. So there's nothing that needs to be written about that. So just with the abdominal part of the assessment, we'd ask the patient if they've been having any abdominal pain, any changes with their diet, appetite, if they've been experiencing any nausea and vomiting, when their last bowel movement, any bowel movement characteristics, like if it's tarry or black, when their last void was, and any characteristics with that, like pain or maybe some hematuria, hopefully not. We're just going to be lifting up your shirt here and maintaining respect and dignity. Expose the abdomen. Okay, so we're going to start by just giving it an inspection. We're going to be looking that there's a hair distribution, how the color is, how the integumentary system is, just like we were doing for the chest. And just every time we see open skin, just making sure everything's intact with that, there's no wounds. So at the contour, we see that it's slightly rounded, or mostly flat. We don't want to see if it's scaphoid. So I see we have a lesion on the left side here, so I'll be making a note of that. And then listening in on the abdomen sounds, we'll start the right lower quadrant, just listening for cascading, gurgling, high-pitched sounds. So just listening until we hear those sounds. So you're doing all 4 quadrants there, noting if it's hyperactive, hypoactive, absent, or active. So that's what you would do for the listening. And then that's what you do for the listening. And then for palpation, you're just going to lightly palpate just for any softness, firmness, perhaps any lumps or masses. Just like kind of when you'd be looking, you see if there's any lumps or masses or symmetry. You can see if they're grimacing or in any pain, but everything seems fine, so I'm going to cover you back up. And then again, whenever we go through, we're just noting the findings we do have on our documentation sheet. Great. So that's the abdomen. And then any exposed area, we would check for the integumentary system or any risk of pressure ulcers or sores. For the unexposed areas like the coccyx, we'll do those at more convenient times, like when they're being turned or changed. So we'll just tell the patient that we'll be doing that later on. And for musculoskeletal, I saw him walking earlier, so he's able to ambulate. You take note of any gait aids used, if he needs help turning, if there's any weakness, and it seems like his strength bilaterally was good when I did those assessments. And you could also do if he's at risk for his fall assessment risk. But everything seems good. We're documented as he went. So we're just going to make sure the patient's lowered and that their callbells is within reach beside them. And that they don't need anything else, and that all railings are up except for the one at the foot there. And yeah,